Health Secretary Jon Ashworth, is in Leicester for us this morning. Mr. Ashworth, thanks a lot for joining us. £600 million a week in cash for the NHS. Sounds like a good thing. Do you back these reforms?
Well, we've long been calling for extra investment in the NHS, as it has indeed staff on the front line and patients, particularly those patients, the 4 million of them on the waiting list and the 26,000 cancer patients waiting beyond 2 months for treatment. But as the Health Foundation today has said, this simply isn't enough. It's because there's no extra money for the social care sector. There's no extra money to deal with the £5 billion worth of repairs that our crumbling hospitals face. There's no plan to deal with the 100,000 staff vacancies across the NHS. So this is really a standstill announcement for the NHS. The NHS should have been getting more investment, and I fear that the waiting list will continue to rise and we won't get the quality of care that we really need. So, you know, more money certainly, but not enough.
OK, more money. How much money would Labour pledge?
Well, what we were saying is that if we were in government this year, we'd be spending nearly £9 billion extra on the NHS and social care. Also, we wouldn't be sending contracts to the private sector. Billions of contracts, billions of money flows out of the public NHS into the private sector. We'd be ending the privatisation of the NHS. But of course, the government have announced these new spending plans. These would be spending plans that we would inherit, would we to form a government in the next few years. So we would match these spending plans, but we would go further still and give the NHS and social care sector more money in the future too.
OK, these are specifically NHS figures, and Mrs May has said that this spending increase is the equivalent of 3.4% in real terms. So you're saying you would spend more than 3.4%?
Yes.
Could you put a figure on that for us?
Because we would be accepting, look, when the Treasury reveal the breakdown of how these figures, the run of these figures for the next 5 years, we'll be able to look at the detail. Because we've got to look at the small print. We've got to look at what it means for public health prevention budgets, what it means for training budgets, what it means for capital budgets. I've talked about the fact there's a £5 billion worth of repair backlog, and we've got all this old, out-of-date equipment. There's a hospital in Leeds using an X-ray machine from the mid-80s, for example. So those budgets are not getting any extra, we don't think, from what we understand from the government's announcements today, because we're still waiting for them to give all the details. But what we're saying is this new baseline, if you like, this new set of NHS budgets for the next few years, we would accept that, we would match that, but we would go further still. We would ask the wealthiest in society, the top 5% of taxpayers, to pay a little bit extra tax. We'd ask big business, the big corporations, to pay a little bit extra tax so we can put more money into the NHS, more money into staffing, more money into social care, which is so crucial these days, and there's nothing on social care today, so we can get the quality of care for the future.
So you agree with where Mrs May has said that it's coming from, this Brexit dividend and a hint at tax rises and borrowing?
Look, she's going to have to increase borrowing and make some different decisions on tax to fund this. The idea that it's coming from some Brexit dividend is it's just laughable nonsense. And I just wish that she'd been honest with people today. I just wish she'd been levelled with people and said, look, yeah, we're going to have to borrow more, we're going to have to tax more, except she's come up with this sort of gimmick, which is unravelling, isn't it? And, you know, she sort of does this, doesn't she? She's never really straight with people. It's really disappointing.
So you think she's lying about this Brexit dividend? It's a straight-out lie?
Yeah, she's not being honest, is she? Why don't she just say to people, we're going to have to increase borrowing? I know that they're Tories and they go on about borrowing, and that's going to be personally quite painful for her and Philip Hammond, the Chancellor. But why doesn't she just level with people for a change? You know, how many times does she say one thing and do something completely different? Like, oh, we're not going to have an election, then we had an election. You know, the police cuts aren't going to have an effect, then they do have an effect. I mean, look, right? She's going to have to increase borrowing. She should have just been absolutely upfront with people in her interview today. Instead, everyone's rowing about this Brexit dividend argument, and it's kind of, you know, our patients on the front line waiting for hours and hours on trolleys, not even able to get a bed. Or if you've been waiting a year for cancer treatment, or if you're waiting 2 years for mental health treatment, or if you're an elderly person who can't get support in the community because social care has been devastated, I think you deserve a bit better than what you've got from Theresa May today.
OK, let's leave alone this Brexit dividend and talk about how you would raise this money. Raising taxes and borrowing, I mean, that's slightly archaic ways of raising funding, isn't it?
Well, we've said that we would increase tax for the wealthiest to fund our additional plans, but it's now up to the government to come forward with their plans. I mean, I've never known, by the way, a government announce money for the NHS and not back it up with the clear plans of how they're going to do it. That's not a sensible way to run government. That's not a long-term plan for the NHS. It's more like a wing and a prayer. When Gordon Brown announced that he was increasing NHS investment substantially, and remember, he did much more than this, by the way, by around 6%, and he got the waiting list down, and we got the highest satisfaction ratings on record. He was clear. He said he was putting up national insurance. He didn't come up with some nonsense like, 4 years down the line there's going to be a dividend from this. He was absolutely straight with people. And they're not being straight with people now. So they've got to come to the House of Commons tomorrow and explain in detail where they think this money is coming from.
OK, if you had to go to the House of Commons tomorrow and explain where this money was going to come from, specifically when it came to taxes, where would you say it would come from? Where would you raise taxes?
Well, we've been clear in all our manifestos that we'd bring rather than cutting corporation tax, and they're going to cut corporation tax again at some point in this Parliament, would increase corporation tax, would ask the wealthiest to pay more in society, would actually increase taxation on private medical insurance as well, for example. So we've got a whole range of proposals on taxation which we think are fair. And I think, when people are so, got such a low opinion of the political process, you've got to be clear with people. And Theresa May hasn't been clear with people today. So I hope her or the Chancellor or Jeremy Hunt, the Health Secretary, can come to the House of Commons tomorrow and give us some clarity, present the details so we can all study them and scrutinise them. It may be that that they're giving more money to these public health prevention budgets and the training budgets and the infrastructure budgets, but it doesn't look like they are based on what they've announced today. So it's really in their interests to give hospital managers, to give clinicians on the front line the clarity that they need so they can plan for the future.
OK, so Theresa May has said that she is going to spend more money. You are saying, Labour is saying that if they were in power, they would spend more money. It's just more money, more money, more money. If you look at somewhere like Singapore, which has excellent healthcare, they spend less on their healthcare than most developed countries. Can't we look at a system like that, which includes public and private healthcare, and possibly take some of what they're doing right?
Well, I think the way we fund healthcare in this country is the fairest way, it's the most equitable way, and it's actually the most efficient way. And there's been umpteen international studies that have shown it. But you're right, we've got to think about the other things in society. We've got a child obesity crisis in this country. That's going to put a huge burden on the NHS in the future. So I would ban the advertising of junk food directed at children on family television in an evening, for example. I would do so much more to improve the health of our children by investing in early years, but getting our children more active, doing things like the daily mile, which is a project where you get children to walk a mile at school and so on. So there's much more we have to do as a society. It's not just about the NHS. I completely accept that, but I do come back to the point though. That also means investing in social care. It means investing in prevention to keep people well so they don't need to rely on the NHS in the future as well. We've got to do this stuff, given we all know that we are an ageing society, and as we age, it's great that we're all living longer, but it means you all live with different conditions. We've got to support people in the community to look after themselves as well.
And privatisation, Mr. Ashworth, is that not an answer here?
Look, we need to be ending the privatisation. £9 billion worth of contracts go out to the private sector. Over the last 8 years, it's something like £50 billion worth of contracts, and they don't provide quality of care. And then when they don't win a contract, you get Virgin Care suing the NHS, taking money from the NHS that should be going to patients. So many times when these contracts go out to privatised, it's really poor quality, and the contracts have to come back in-house. And that means we've wasted lots of money. So Labour's going to end the privatisation of the NHS, which is going on under the Tories, and bring contracts back in-house.
OK, Jon Ashworth, Shadow Health Secretary, thanks a lot for talking to us this morning.
Thank you.